The following segment is paid for by Holston Medical Group.
This month is Cervical Health Awareness Month, an important topic for women. Like most cancers, early detection is key when it comes to cervical cancer. In tonight's HMG Health Matters, we sit down with a women's health expert to learn more about important screenings.
Unfortunately, there is a rise of cervical cancer. Approximately last year in 2025, estimated of new diagnosis around 13,000 women, new cases of cervical cancer. And in those cases, approximately 43 of those cases died, which is quite unfortunate, especially when it's a disease that could be preventable.
And that is why Dr. Jessica Walker is passionate about women's health and important screenings that can detect any early form of cancer. Any abnormalities. She says cervical cancer can affect women of all ages, but is most common among women 35 to 64 years old.
Age 21 to age 30, we do cytology, which is just scraping cells to take a look at them, normal, not normal. After the age of 30, then we can add HPV. Most often we use something called co-testing that looks at the cells and looks at the HPV screening as well. After the age of 30, we can start doing this every 5 years. Now, there are some also new testing which focus only on HPV. We call that primary HPV testing. And there is also a new tool that it was approved last month by the FDA, which is a self-collecting swab HPV testing. And I think that's going to be very helpful for patients that have barriers to care.
Dr. Walker says these screenings are crucial as doctors want to catch it early before it has a chance to develop into cancer cells. She says most of the time, symptoms don't actually begin until the cancer has spread to other organs.
Some of the symptoms that our patients could be experiencing will be pain, generalized pelvic pain, pain with sexual activity, also periods, yes, menstrual periods, but most importantly, bleeding that is not scheduled. Another one could be swollen lymph nodes, swollen legs.
Dr. Walker also says there are some things you can do to help prevent cervical cancer. She says not smoking is important, and she recommends the vaccine for certain women.
Gardasil vaccine is there for primary prevention, and current studies have demonstrated that women that have been properly vaccinated have decreased their chance of cervical cancer, but sometimes 40 to 60%.
Dr. Walker says it's important for women to have an annual well visit, even if they are not due for a screening test. She says that's an important time to go over your health in general in case there is something unusual that might require earlier testing. For more information on this important topic, please visit the Health Matters blog at holstonmedicalgroup.com.